Question 1. A client who has been admitted to the inpatient mental health unit with a diagnosis of bipolar disorder is constantly arranging the client's snack area and sweeping the unit's floors. The client also follows the housekeeper, offering advice on the best way to clean. Which activity is most appropriate for this client? C. Hiking. This client is obviously active, so the appropriate activity will allow them to continue to use physical energy. Hiking is an example. Other options might be playing basketball, table tennis, or jogging. The other options do not allow for vigorous movement, they require concentration and self-control, which the client does not have at this time. Question 2. The nurse at a substance abuse center reviews the record of a new client and notes that the client has a dual diagnosis. This means that along with the substance abuse disorder, the client is also being treated for C. A mental disorder not caused by the substance. A person with dual diagnosis has both A and NBSB, mental disorder and NBSB, ANN and NBSB, alcohol and NBSB, or and NBSB, drug and NBSB, problem. These conditions frequently occur together. About half of the persons who have a mental disorder will also have a substance abuse disorder at some point in their lives, and vice versa. Question 3. A 27-year-old gravida 2 para 1 delivers a stillborn infant. The mother asks the nurse, "Why did this happen to my baby?" What is the nurse's most appropriate response? B. Would you like to see and hold your baby? The loss of a child at any stage causes grief for parents, who have begun to bond with their baby even before it is born. Another child doesn't replace this one. Seeing and holding their baby can help them realize the loss and can facilitate the grief process. Question 4. A nurse is teaching a 16-year-old male client to self-catheterize as part of his rehabilitation following a T4 spinal cord injury. The client is frustrated and says, "I can't do this, it's too hard. Why can't I just keep the Foley?" What is the nurse's best response? B. I know it's a lot to learn. But you'll prevent infections this way. Always acknowledge the client's feelings. Provide useful and factual information in a non-judgmental manner. Do not avoid the task or intimidate the client. Intermittent catheterization can reduce the frequency of urinary tract infections, UTI. A young client has the hand dexterity to learn self-catheterization, but the final decision about the method of bladder elimination is his, not the physician's. Question 5. A mother brings her 15-year-old daughter to the clinic after realizing that the girl has lost 20% of her body weight. The girl admits to binge eating and then purging via self-induced vomiting. The nurse suspects the girl has C. Bulimia nervosa. Bulimia nervosa is a serious eating disorder that usually affects young females. It is characterized by episodes of extreme food intake, followed by self-induced vomiting in an attempt to lose weight. Anorexia nervosa is a pathological fear of weight gain, with self-starvation, excessive exercise, an altered body image. Conversion disorder is when a person experiences blindness, paralysis, or other symptoms affecting the nervous system that cannot be explained solely by a physical illness or injury. Gastrohysteria is not a medical term. Question 6. A 19-year-old male with osteosarcoma has been readmitted after aggressive treatment failed. He knows he will not survive. The primary nursing goal for this young client is to reduce A. Social isolation. When family and friends learn that someone is terminally ill, they often feel awkward and stop visiting or communicating with the client. The nurse can provide support by talking with the client, especially about his feelings. The nurse can also assist visitors in being less uncomfortable around the client. Question 7. All of the following are symptoms of depression except C. Increased sex drive. In depression, there is decreased interest in most normal activities, including sex. The other answer options are all symptoms of depression. Other symptoms include restlessness, increased or decreased appetite, inability to concentrate, lack of energy, excessive crying, social isolation, and feelings of hopelessness or emptiness. Question 8. A mother calls the pediatric clinic, concerned that her 3-year-old son has an imaginary friend. What should the nurse tell the mother? C. This isn't unusual for young children. It's creative play. Imaginary friends are common with young children. Up to 65% of children will have one before they are 7 years old. Some are invisible, and others are personified objects, such as teddy bears or dolls. Eldest and only children are more likely to have imaginary playmates. Creating and sustaining an imaginary friendship is a sophisticated cognitive skill. Question 9. The nurse is interviewing a new mother who gave birth 1 month ago. The mother has a documented history of substance abuse disorder. What is the first question the nurse should ask the mother? A. When was the last time you used an illegal substance? The nurse should first ask a direct question about the mother's possible drug abuse. The other questions are appropriate after determining if the mother is using illegal substances since giving birth. Question 10. The nurse is educating parents of a 7-year-old girl who is about to start chemotherapy. The nurse tells them that their daughter will likely experience alopecia, loss of hair, from the treatment. The best approach for the nurse is to A. Advise them to get a wig for their daughter prior to starting treatment. Children are very aware of their appearance. In hair loss from chemotherapy, the hair tends to come out in clumps, resulting in an uneven appearance. The nurse should advise the parents to get a wig for their daughter so that she can maintain her appearance as much as possible. And never add to the parents' confusion by pretending they still are in their previous situation. They will now be reminded of their daughter's illness by her appearance. Question 11. A 32-year-old female is admitted to the inpatient psychiatric unit with a diagnosis of bipolar disorder. Her husband is concerned because for the past 6 weeks, She has been sleeping about 3 hours a night. She constantly shops online, causing them to be in debt. She has lost 10 pounds because she doesn't stop to eat. During the initial assessment, what behavior should the nurse anticipate? C. Bold statements about her self-importance. During the manic phase of bipolar disorder, clients can display grandiosity and an exaggerated sense of self-worth. They lack the ability to focus and consider their need for treatment or the consequences of their actions. Often, they are also rude and condescending to others. Question 12. The nurse on an inpatient mental health unit approaches a client who is actively experiencing an auditory hallucination. Which of the following statements by the nurse is most therapeutic? B. Can you tell me what the voice is telling you to do right now? Do not pretend to also be experiencing the hallucination. Do not try to convince the client that the hallucination isn't real, it is real for them. The most frequent hallucination involves hearing, often voices that tell the client what to do. Ask questions such as, "Are you hearing voices other than mine? What are they telling you? What do you see, feel, taste, smell?" Tell the client, "I don't hear the voices, see what you see, etc., but I believe that you do." Instruct the client to listen to your voice and not the other voices, or to look at you rather than whatever else they are seeing. Do not tease or criticize the client. Question 13. Which eating disorder puts a client at the greatest risk of fluctuating serum electrolyte levels? A. Bulimia nervosa. Electrolyte imbalances are typically common in those with bulimia. Up to 49% of individuals with severe symptoms of bulimia have imbalances such as sodium and potassium. Vomiting, laxatives, and diuretics can cause electrolyte imbalances in the body, most commonly in the form of low potassium levels. Low potassium levels can trigger a wide range of symptoms, from lethargy and cloudy thinking to irregular heartbeat and death. Chronically low levels of potassium can also result in kidney failure. And NBSB, hypocalcemia, can result from long-term use of diuretics. Magnesium and bicarbonate levels are also affected by hydration. Pica disorder involves eating things that are not considered food. Rumination disorder is a condition in which a person regurgitates food that they have previously chewed and swallowed, chews it again, and then either swallows it again or spits it out. Question 14. When a nurse interviews the parents of a 15-year-old girl diagnosed with anorexia nervosa, the parents tell the nurse they don't understand why their daughter refuses to eat. They state that she has always been so compliant and eager to please them. Which relationship style describes this family? A. Enmeshment. Enmeshment occurs when personal boundaries become unclear. In enmeshed families, children are raised to follow the parents' expectations in all life areas rather than become independent individuals. A child who must follow strict family rules can develop anorexia nervosa to control the one area that parents can't control, eating behavior. Question 15. An adult client on the inpatient mental health unit has consented to electroconvulsive therapy, ECT. The client understands the procedure, but their spouse is very anxious, stating, "My spouse's brain is going to be destroyed. How can you do this?" What is the nurse's best response? A. It sounds like you have concerns. Let's talk about them. The nurse should invite the spouse and client to discuss concerns, ask questions, and express their feelings. Electroconvulsive therapy, ECT, is a medical treatment most commonly used in patients with severe major depression or bipolar disorder that has not responded to other treatments. ECT involves a brief electrical stimulation of the brain while the patient is under anesthesia. The other options do not invite open discussion. Question 16. After a spontaneous abortion at 13 weeks gestation, a client reports for a follow-up at the OB/GYN clinic. The nurse observes that the client is crying. What is the nurse's best response? B. This must be a really difficult time for you. Tell me what you're feeling. The nurse should not try to minimize the client's loss. Offering platitudes, such as having another pregnancy, show a lack of compassion. Ask the client how she is feeling and coping. Observe for signs of depression and report them to the provider as indicated. Question 17. A client becomes visibly uncomfortable while providing answers to the nurse for the social sexual questions of a complete health history. What is the nurse's most appropriate response? B. I know this is uncomfortable. It's important that we have the most accurate information. The best response for the nurse is to acknowledge the client's discomfort with a supportive statement, "I can tell you're uncomfortable." Most clients have a difficult time talking about personal issues. Making a joke is disrespectful. Skipping the questions will not obtain potentially important health information. Ignoring the client's discomfort is rude and insensitive. Question 18. A 4-year-old is admitted for a tonsillectomy and adenoidectomy. The pediatric nurse observes that the parents are reluctant to participate in their child's care. Which of the following might be a reason for their behavior? B. The parents feel anxious and intimidated. As the advocate for patients and their families, the nurse should seek to understand their behaviors. These parents are in an unfamiliar setting, and their child's health is at stake. They may not know what to do or how to get the accurate information they need. Involving them in their child's care decreases their sense of helplessness and increases their confidence. The other responses are judgmental and inappropriate for the nurse. Question 19. The nurse is educating a client with a new diagnosis of major depressive disorder. The client states that they are reluctant to take the prescribed medication. What is the nurse's best response? B. Tell me your concerns about taking this medication. The nurse should validate the client's feelings and initiate therapeutic communication regarding the client's concerns. The nurse can then continue education as indicated. Threatening electroconvulsive therapy, ECT, is coercive. Waiting until the next appointment is inappropriate, since the client needs to begin the medication as soon as possible. Giving a vague explanation of "you won't feel better" is not helpful to the client. Question 20. When the nurse delivers a lunch tray to a Jewish patient, the patient declines to eat because the tray has a hamburger, fries, and a milkshake. What should the nurse do? C. Call the dietary department to bring a new tray. Jewish people are not permitted to combine meat and milk for cooking, eating, or even placement on the same tray. According to the Torah, you may not cook a young animal in the milk of its mother. The nurse should immediately remove the tray and contact the kitchen for a kosher meal. Question 21. The mental health nurse is giving a presentation at a community center on domestic spousal abuse. Which one of the following is a risk factor? C. Witnessing domestic abuse as a child. Risk factors for domestic spousal abuse include alcohol or drug abuse, low income or poverty level, being under the age of 30, an unplanned pregnancy, witnessing domestic violence as a child, history of abuse as a child, and history of abusive relationships. A higher education level and a large circle of friends reduce the risk, but do not eliminate it. Question 22. After a client has completed an inpatient treatment program for alcohol addiction, which statement by the client would indicate an understanding of the disease process? C. From now on, I must avoid alcohol and go to AA meetings. Clients who are addicted to alcohol must avoid drinking for the rest of their lives. They are unable to drink socially, because of the loss of control. Alcohol abuse and addiction may run in families, but this does not excuse the client's choices and behaviors. For alcoholics, blaming situations is not an effective coping mechanism. Question 23. The nurse is instructing a client who has just been prescribed fluoxetine, Prozac, for depression. At what time of day should the client take the medication? C. Morning. Fluoxetine is a selective serotonin reuptake inhibitor, SSRI, antidepressant. The nurse should instruct the client to initially take the medication in the morning for least interference with sleep. Fluoxetine can be taken with or without food. The prescriber's digital reference, formerly called the physician's desk reference, notes that 5 to 10% of clients may experience a sedative effect from fluoxetine and may need to switch to an evening dose after evaluation. Question 24. A schizophrenic client tells the nurse, "Zing bing, the world is a ring." What is the nurse's most therapeutic response? B. I can't understand what you're saying. Schizophrenia is characterized by a deterioration of mental functioning. The client may have trouble putting thoughts into words. The nurse should never pretend to understand something that does not make sense, or to interpret the client's words as something that does make sense. Clanging is when a client speaks in rhymes. Question 25. A client admitted to the inpatient alcohol dependency unit asks to speak with the nurse alone. When they sit in a private corner of the day room, the client says, "I know I should get out of this bad situation." What is the nurse's most therapeutic response? C. Can you tell me what you feel is so difficult about this situation? The nurse should encourage the client to talk about their feelings regarding whatever their situation is. Once the nurse has more information, they can assist the client in making a plan or guiding their decision. Telling the client they can simply leave without knowing more is not therapeutic. While talking with their spouse or waiting to make a big decision can be appropriate actions, they are not the best therapeutic actions at this time. Question 26. When a nurse is trying to communicate with a client who does not speak English, what is the nurse's best action? B. Request a translator to assist. A translator should be used when communicating with a client who does not speak English or has poor English skills. Title VI of the 1964 Civil Rights Act requires healthcare providers who receive federal financial assistance to provide services for persons with limited English proficiency. Using picture boards and gestures may be helpful for basic care, but the client and family are entitled to understand the client's medical treatment in their own language. Question 27. A client is in a memory care unit because of advanced dementia. The client's spouse is invited to participate in the team meeting to discuss the client's plan of care. The client has recently started to display agitation, confusion, and aggression in the late afternoon. The spouse and team agree that the best initial action is which of the following? B. Allow the spouse to visit the client during late afternoons and evenings. Clients who display confusion, anxiety, aggression, or fear in late afternoons or evenings are exhibiting sundowning behavior. It can also include pacing or wandering. The exact cause is unknown, but it is seen in clients with dementia or Alzheimer's disease. In a care facility, sundowning may be related to the lack of structured activities later in the day, the staff leaving at change of shift, or reminding the clients of their past, when they used to go home after work. Maintaining a predictable routine and providing familiar people or items may help. Provide adequate lighting and play familiar music to reduce the client's level of anxiety. The other interventions are not appropriate for a client with advanced dementia. Question 28. The nurse working on the inpatient mental health unit is assigned to care for a client admitted 3 days ago for major depression. Since their admission, the client has self-isolated and has not interacted with staff or other inpatients. What is the nurse's best statement to the client to encourage participation? A. Come join me and another nurse in an easy board game. The nurse should give a clear and direct statement that provides a behavioral expectation for the client. A simple activity with a few people is a therapeutic way to begin participation. Telling the client that staff is only interacting in order to comply with the HCP's order does not show interest in the client. Avoid why questions, since they are seen as confrontational. An art project might reduce the client's anxiety, but is a solitary activity. The goal is to include the client in more group activities. Question 29. A client is brought by his friends to the emergency department. They tell the nurse that he has been shouting, "I am God." The nurse knows the client is experiencing B. A delusion. Delusion is a false belief. Hallucination is a false sensory perception involving any of the senses. Illusion is the misrepresentation of a real, external sensory experience. Effusion is a non-psychiatric term, meaning giving off a light, smell, or liquid. Question 30. A client diagnosed with paranoia insists that her food is poisoned. What is the nurse's best response? B. The food is not poisoned. It's safe. Paranoia is characterized by mistrust and suspicion. The nurse should consistently provide truth as a means of genuine support. Arguments, collusion, or threats are not therapeutic. Question 31. The nurse is caring for a client during electroconvulsive therapy, ECT. Which of the following nursing actions is most important for client safety? C. Monitor the client's airway and perform suctioning as needed. The nurse should follow the ABC priorities for client safety: airway, breathing, circulation. The nurse will be prepared to suction the client's airway and assist with oxygenation as necessary. Checking vital signs and positioning the client may also take place, but are not the priority. Removing dentures, glasses, etc. are done prior to the treatment. Question 32. A client who has experienced chronic neck and back pain is diagnosed with pain disorder and depression. During a clinic appointment, she tells the nurse, "Nothing anyone has done here has helped me." Which of the following statements by the client requires immediate intervention? B. I'm going to finally find a way to end this terrible pain. Immediate follow-up and intervention are necessary when a client makes a statement indicating possible suicide. Pain disorder and NBSB is a psychological disorder that causes sufferers to experience pain. It is considered a mental disorder because psychological factors can aggravate the physical pain. These factors can influence the onset, severity, and maintenance of pain. Common symptoms of pain disorder are negative or distorted cognition, such as feelings of despair or hopelessness, inactivity and passivity, in some cases disability, increased pain, sometimes requiring clinical treatment, sleep disturbance and fatigue, disruption of social relationships, depression and anxiety. Question 33. Parents discover their 8-month-old infant in his crib, not breathing. EMS is called to resuscitate, but the baby is pronounced dead on arrival, DOA, at the hospital, with a tentative cause of sudden infant death syndrome, SIDS. What is the nurse's most appropriate action? D. Take the parents to a private room to be with their baby. Sudden infant death syndrome, SIDS, is the sudden and unexplained death of an infant usually between 2 weeks and 1 year of age. Because of the unexpected event, parents can't comprehend that their healthy baby has died. Their most immediate need is to have the opportunity to begin to face and accept their loss. Personal contact and the chance to say goodbye can promote a healthy grieving process. An autopsy will likely be mandated, so no parental consent is needed. The other actions can take place at a later time. Question 34. The best therapeutic action for a client with organic brain syndrome is to D. Maintain a safe, consistent environment. Organic brain syndrome is a term used to define dementia or other brain diseases that have a physiological cause, as contrasted with conditions that are psychiatric. Care and actions are the same as for any client with dementia or Alzheimer's disease. Client safety and a sense of security are the priorities. Question 35. When the nurse instructs a client about his new prescription for a lithium medication, which of the following is correct? D. Maintain a balanced sodium intake. Lithium medications are lithium salts, so sodium balance is necessary. If dietary salt is eliminated or reduced, lithium levels can rise, causing toxicity. If dietary sodium is increased, lithium levels can fall. The recommended daily sodium intake is 5 to 6 grams per day. Question 36. After several remissions from brain cancer, a 10-year-old's condition has become terminal. The parents ask the nurse how they should talk to their child about what to expect. The nurse's best statement for encouraging open discussion about the child's prognosis is: D. Talking now will allow your child not to feel scared or alone. Sharing the truth leads to an opportunity for shared support and the ability to face the loss together. The child can express their fears, and the parents can provide comfort. All of them will have a chance to say things that need to be said, without regret. Avoiding the truth or attempting to protect the child are not good options for any of them. Question 37. An 85-year-old female who owned an Italian restaurant tells the nurse, "I need to go. My restaurant will open at 11 o'clock this morning. I need to be there." What is the nurse's best response? D. You once owned a restaurant. Tell me more about it. Reality orientation requires support. When reorienting a client to reality, always address the person's feelings. Do not minimize or dismiss the client's feelings. Respect is most important. Never patronize or go along with a client's delusion. And never pretend to add to a client's confusion by suggesting the person could be correct. Question 38. The nurse on an inpatient mental health unit is caring for a client with severe depression. All of the following activities are appropriate for this client except: D. Joining a chess tournament. Chores can be therapeutic. Organizing an area, washing dishes, or sweeping can feel meaningful. A jigsaw puzzle occupies the client's mind and is not time-focused. Adult coloring books have shown to be useful in treating depression. Playing a game that requires stressful choices or is a win-lose endeavor can lead to self-criticism and low self-esteem. Question 39. A parent brings their adolescent to the mental health clinic, concerned because since early teenage years, the adolescent has been getting into trouble with the police. They lie, steal, get into fights, and destroy property. The parent is especially concerned because the adolescent never shows remorse. Which of the following personality disorders are the adolescent's behaviors characteristic of? D. Antisocial. Antisocial personality disorder is a chronic mental health condition, and NBSB, characterized by a disregard for the safety, feelings, and rights of others. The disorder is more common in males, with 80% displaying signs at about age 11. Antisocial behavior disorder is demonstrated by repeatedly breaking the law, lying, fighting, and stealing, harming property or animals, problems with substance abuse, and impulsive actions. The person does not show guilt or remorse. The disorder is sometimes called sociopathic. Question 40. A mother brings her 3-month-old infant to the clinic for a routine checkup, along with her 4-year-old daughter. Which behavior by the older child indicates the developmental phase called identification? D. The daughter pretends to feed her doll. Identification is behavior that imitates the same-gender parent or another adult. For this question, caring for the doll shows identification of the daughter with her mother. The other behaviors signify cognitive development. Question 41. The nurse is doing an initial intake with a 19-year-old female who was diagnosed with an eating disorder. The client says, "I hate the way I look. I'm so ugly." What is the nurse's best response? D. Can you tell me why you feel that way? The nurse should ask more questions to find out why the client feels as she does and to discover related reasons for the eating disorder. The nurse should also assess the possibility of self-harm or suicide. The other responses are inappropriate because they disregard the client's feelings and behavior. Question 42. An 80-year-old man, whose wife died 9 years ago, tells the nurse that he still visits his wife's grave every day. He can't think of anything but her, cries daily, and is unable to properly care for himself. What type of grief is the client experiencing? D. Complicated. Complicated grief is like being in an ongoing, heightened state of mourning that keeps preventing healing. Normal grief symptoms gradually start to fade over time, but in complicated grief, symptoms linger or intensify in various ways, focusing on little other than the death and reminders of the loved one, intense and persistent longing for the loved one, inability to accept the death, numbness or detachment, feelings that life has no meaning, and difficulty making decisions or taking care of oneself. Delayed grief isn't experienced at the time of the loss, but happens later. Unrealistic grief is not a term. Question 43. Which of the following most accurately describes cognitive therapy? D. It alters a client's irrational beliefs. Cognitive therapy is a type of psychotherapy in which negative thinking is explored to change undesirable behavior. The intent is that by understanding their irrational beliefs, the client can change the unwanted behavior. The other options represent alternative psychotherapeutic methods. Question 44. In Maslow's hierarchy of needs, which stage is the most fundamental? D. Physiological. In Maslow's hierarchy of needs, the biological essentials for human survival must be met first: air, food, drink, shelter, clothing, warmth, and sleep. Once these are met, the next level is safety, then love and belonging, followed by esteem. The final level is self-actualization. Question 45. When assessing a child who presents to the emergency department with scalds from hot liquid from a stove, which body area may indicate possible abuse? D. Burns on the front of the body. When a hot liquid falls from a height, such as a stove or a counter, the burn is typically a splatter pattern, with irregular margins and irregular skin depth, occurring on the front of the body. The nurse should measure the child's height and ask if the child can reach the stove or handle of the pan. Were the caregivers present? Does the child usually play in the kitchen? Examine and keep the clothing that the child was wearing at the time of the incident. The other burns are more typical of abuse, and often have delineated borders.